Hello, my name is Veronica Okoye. I'm a family nurse practitioner and a Doctor of Nursing Practice candidate at Wagner College. My presentation will be about pre-participation cardiac screening in sports. This presentation aims to equip healthcare providers with the knowledge needed to perform effective pre-participation cardiac screening in an effort to prevent sudden cardiac death in athletes, ensuring safety and optimal health outcomes. Learning objectives. The objectives in this presentation aim to provide a comprehensive understanding of sudden cardiac death in sports as a public health issue. At the end of this presentation, you should be able to define sudden cardiac death, the etiology and prevalence of sudden cardiac death in athletes, able to recognize the common risk factors, red flags, and warning signs and symptoms of indicative of potential cardiac issues during screening assessments, able to define and understand the importance of pre-participation cardiac screening and why it is necessary, able to utilize screening guidelines and recommendations. Finally, you will be able to interpret electrocardiogram EKG findings associated with sudden cardiac death and develop proficiency in establishing referral pathways. Population of youth participating in sports in the United States. The population of youths participating in sports in the United States has increased exponentially. The data from National Federation of High School Association between 2018 and 2019 estimated that 60 million children and adolescents and 7.9 million high school students participated in various sports. Also, the data collected from National Collegiate Athletic Association in 2021-2022 seasons reported that 520,000 student-athletes participated in NCAA championship sports across all three divisions. Definition and etiology of sudden cardiac death in athletes. Sudden cardiac death is defined as an abrupt loss of heart function. It is the swift and not expected ending of all heart activities. Breathing and blood flow stop right away. Within seconds, the person is not conscious and dies. Etiology of sudden cardiac death includes structural heart disease such as hypertrophic cardiomyopathy, arrhythmogenic right ventricular cardiomyopathy, congenital coronary artery anomalies, myocarditis, aortic dissection or rupture, electrical abnormalities such as lung QT syndrome, Brugada syndrome, catecholaminergic polymorphic ventricular tachycardia. Other causes, but rare, also include commercial codis. Prevalence of sudden cardiac death in athletes. Prevalence of sudden cardiac death ranges from 0.5 to 13 deaths per 100,000 athletes. Heart conditions that are not diagnosed, such as genetic heart disease, can cause sudden cardiac death in teenagers and young adults during physical activities, such as competitive sports. Studies show that 50 to 60% sudden cardiac death in young athletes are attributed to inherited or congenital cardiac abnormalities, and the most common condition is hypertrophic cardiomyopathy. But sudden cardiac death can occur without activity. 60 to 80% of patients with sudden cardiac death had no symptoms. American Academy of Pediatrics (CDC) data estimated that about 2,000 individuals younger than age 25 die each year of sudden cardiac arrest in United States. Incidence of sudden cardiac death. Sudden cardiac death is a rare but devastating event that can occur in young athletes, often during or shortly after physical activity. Incidence varies among studies. Sudden cardiac death most commonly affects athletes aged 17 to 24, between 1.2 to 1.9 per 100,000. although it can occur in younger or older individuals. In Italy, 3.6 per 100,000 reduced to 0.9 per 100,000 after screening initiated. In comparison, age less than 35 versus greater than 35 showed that the incident does not occur as frequently in age less than 35 years old as in age greater than 35 years old. Sudden cardiac death statistics among young athletes. Research data showed that among inherited cardiac abnormalities, hypertrophic cardiomyopathy is the most common cause of sudden cardiac death in young athletes. Etiology of sudden cardiac death in athletes over time. Based on the multiple studies over time, hypertrophic cardiomyopathy is known to be the most common cause of sudden cardiac death in young athletes in the United States, accounting for about 36% of cases. The risk and causes of sudden cardiac death varies based on the athlete's populations, male gender, Black race, and basketball participation. In all, places athletes at a higher risk. Sudden cardiac death in athletes is a critical concern, with risks and causes varying across different populations. According to research by Herman, 2015, several factors increase the risk of sudden cardiac death in athletes. Male gender. Male athletes are at a high risk of sudden cardiac death compared to female athletes. This increased risk is thought to be due to a combination of genetic, hormonal, and lifestyle factors that predispose men to cardiovascular issues. Black race. Black athletes, particularly those of African descent, are at a disproportionately high risk of sudden cardiac death. This elevated risk is often attributed to a higher prevalence of certain conditions such as hypertrophic cardiomyopathy and sickle cell trait, which are more common in this population. Basketball participation. Basketball players are also at a higher risk of sudden cardiac death, particularly in the United States. The sports involve high-intensity bursts of activities that can place significant stress on the cardiovascular system. Wasfi et al. of 2016 conducted a study that identified several key risk factors for sudden cardiac death among National Collegiate Athletic Association (NCAA) athletes. The study highlighted the following risk factors: male gender, Black race, basketball participation, particularly at the collegiate level. Football participation was also noted as a high-risk sport. Division I participation. Athletes competing in Division I, the highest level of NCAA competition, were found to be at a greater risk. Red flags and high-risk cases. Identifying red flags and recognizing high-risk cases is critical to preventing sudden cardiac death and other cardiovascular events in athletes. Family history red flags include sudden cardiac death before age 50 of family member. It may suggest inherited conditions such as HOCM, ARVC, or long QT syndrome. Cardiovascular examination red flags include abnormal heart sound, heart murmurs, elevated blood pressure, abnormal pulses. Electrocardiogram ECG red flags include abnormal T-wave inversion. T-wave inversion in leads where they are not expected can indicate conditions such as HOCM or ARVC. Prolonged QT intervals. A prolonged QT interval on ECG is a major red flag for long QT syndrome, which can predispose the athlete to dangerous arrhythmias. Signs and symptoms of sudden cardiac death: chest pains or discomfort, shortness of breath, sudden collapse or loss of consciousness, palpitations or rapid heartbeat, fatigue or weakness, dizziness or lightheadedness, not responsive to CPR or defibrillation in sudden cardiac arrest situations. Prevention of sudden cardiac death with pre-participation of cardiac screening. According to the American Heart Association, the definition of pre-participation is systematic practice of medically evaluating large general population of athletes before participation in sports for the purpose of identifying or raising suspicion of abnormalities that could provoke disease progression, or sudden death. The role of screening in preventing sudden cardiac death among athletes. Screening plays a critical role in preventing sudden cardiac death among athletes by identifying those with underlying cardiovascular conditions that may predispose them to life-threatening events during physical activities. Identification of underlying conditions such as hypertrophic cardiomyopathy, arrhythmogenic right ventricular cardiomyopathy, long QT syndrome, and other congenital or acquired heart disease. Risk stratification helps to categorize athletes into different risk levels. Those identified as high risk may require further testing, lifestyle modification, or be advised to avoid certain sports to mitigate the risk of sudden cardiac death. Athlete-specific consideration. Screening allows healthcare providers to make tailored recommendations about which sports or activities are safe for the athlete to engage in, reducing the risk of sudden cardiac death. Public health impact. Systematic screening programs have the potential to significantly reduce the incidence of sudden cardiac death in athlete populations. When high-risk individuals are identified and appropriately managed, the number of sudden deaths during sports can be minimized. Awareness and education. Screening programs also serve as an educational opportunity, helping athletes and their families understand the risks associated with certain heart conditions. Importance of pre-participation cardiac screening. Pre-participation cardiac screening is vital for promoting cardiovascular health and reducing risks associated with heart conditions in athletes. Early detection of underlying heart conditions in individuals before engaging in physical activities is very crucial for the safety of the athletes. Screening helps detect abnormalities that may increase the risk of sudden cardiac death during exhaustion. Furthermore, timely identification of cardiac issues allows for appropriate intervention and management strategies to be implemented. Early detection plays a crucial role in ensuring athlete safety during exercise and sports participation and helps prevent adverse outcomes such as sudden cardiac death. The screening modalities that the primary health care providers need to achieve these goals are the use of American Heart Association 14-point evaluation and electrocardiogram (EKG). Pre-participation comprehensive screening assessments. Comprehensive screening assessments are essential for evaluating the cardiovascular health of athletes before they participate in sports. These assessments combine a detailed medical history, physical examination, and advanced diagnostic tools such as electrocardiogram (EKG) to identify individuals at risk for sudden cardiac death and other cardiac events. Screening tools for pre-participation cardiac screening. The American Heart Association 14-point assessment. The American Heart Association 14-point checklist includes questions about personal and family medical history, as well as a focused physical examination, aimed at detecting cardiovascular abnormalities. It guides healthcare providers through a series of questions and physical examination steps to identify athletes who may be at risk for sudden cardiac death. Pre-participation cardiac screening plus 12-lead electrocardiogram (ECG). Purpose: the ECG is a primary tool for detecting electrical abnormalities in the heart that could predispose an athlete to sudden cardiac death. Interpretation guidelines: using the Seattle criteria or international criteria helps distinguish between normal and abnormal ECG findings in athletes, thereby reducing false positives. Common findings in athletes: normal athletic changes include sinus bradycardia, early repolarization, increased QRS voltage due to left ventricular hypertrophy. Abnormal findings include pathological Q waves, T wave inversion, ST segment depression, prolonged QT interval, and abnormal rhythms that may indicate underlying heart disease. Benefits and advantages of ECG: it is readily available. It can identify problems that may be missed on physical exam. It can detect left ventricular hypertrophy, prolonged QT, rhythm disturbances, and finally, it can be done inexpensively. Pre-participation cardiac screening recommendations should take place in primary care setting. Focus on identifying pathologic heart murmurs or stigmata of Marfan syndrome and include in annual physical. Referral pathways: this flowchart simplifies the process of pre-participation cardiovascular screening and ensures that high-risk athletes receive the necessary follow-up to prevent sudden cardiac death while promoting safe sports participation. Initial assessments: for moderate to high-intensity sports, routine cardiovascular screening recommend standard history and physical examination using American Heart Association 14-point evaluation and EKG. Abnormal findings: any positive elements in the standardized questionnaire, abnormal physical findings, 2 or more borderline EKG findings, or 1 or more abnormal EKG findings. If yes, refer to a cardiologist for further evaluations. If no abnormalities identified, then the individual is cleared for participation. The athlete is cleared to participate without restrictions. If further testing and evaluation do not identify any significant risk, the athlete may be cleared for participation. Summary: key facts. In conclusion, let's recap the key facts in this presentation. First, sudden cardiac death is an abrupt loss of heart function. Inherited cardiac abnormality is the leading cause of sudden cardiac death in athletes. The percentage of sudden cardiac death in young athletes due to inherited cardiac abnormality is about 50 to 60%. Hypertrophic cardiomyopathy is the most common cardiac abnormality associated with sudden cardiac death in athletes. Annual pre-participation cardiac screening for young athletes is recommended. Electrocardiogram is cardiac diagnostic test for measuring heart electrical activities for pre-participation cardiac screening. Adolescents and young adults are at high risk for sudden cardiac death during sports participation. American Heart Association recommended 14-point pre-participation cardiac screening evaluation. Family history of cardiac conditions is one of the risk factors for sudden cardiac death during physical activities. Long QT syndrome is commonly associated with exertional ventricular arrhythmia. Thank you so much for your time. For questions, you can contact me at the email address below.